For me, just being vulnerable and authentic and the experience of living as a healthcare worker through these challenging times is important. And I think that there's a greater story to be told, not just of, the admissions to the hospital or the data that comes out about the severity of this pandemic, but also just of the emotional toll that it's taken on my colleagues, our hospital systems, and the people that work within it. And so I just, for me, it's about being genuine to being human, and that this has impacted us, and just thinking about going through it all over again, especially through a Delta wave that seemingly will affect more and more children this time. And that's the space that I work in, is heartbreaking to think about. And so the cumulative weight of all of that for me just has hit me as a leader in a healthcare institution, about having to lead a team through this again, and now with less staff, less resources, in a way that, we have a sense that this was preventable. It's difficult. And so I just wanted to show that authentic side of that it's challenging, and there are good and bad days. We show up to do meaningful, compassionate, loving work for the patients that we care for. But there are days that it really hits us hard.
Yeah. I saw that Ellen Pompeo retweeted your post. She said heartbreaking. And then there were other healthcare professionals that joined in that conversation. I saw one where he said, "Not crying today, but a look at my face says it all." Do you feel like your post, you're able to connect with other people to have this conversation about how you're feeling, and what's the value of that?
Yeah, I hope so. And it's, the importance of being able to connect with people all over that have similar experiences. But I also see it every day on the faces of my colleagues here in the hospital halls, around campus, in meetings of colleagues that are just feeling this different level of exhaustion and distress of that we're ramping up to go through this again. And so I think it's important that we have spaces to talk about that safely, that we shelve toxic masculinity, and we shelve these pretenses of work cultures that don't allow for us to vulnerably cry and be ourselves, that this is a space and a time to embrace that I'm a human being, and showing up to do a difficult job, as so many of us are. But I think that we have to have spaces to unpack that too, so that we can go home, for me, to my 3 kids and my wife, in a way that I'm emotionally available to be able to do that.
Are you seeing more kids impacted by COVID come in through your area of specialty, which is the palliative care?
So specifically in the work that I do in palliative care, not yet with this wave, but I'll tell you that it's hitting our outpatient pediatrics clinics, our emergency room doors. I have colleagues all over that, seeing 40 plus patients a day in an outpatient pediatric clinic, and over half of those are getting tested. And so, I think we're ramping up and gearing up and preparing ourselves for the wave of patients that we'll be seeing more and more in the hospital. And that's part of this tension right now too, is this buildup, this fear, this anxiety, this, how much trauma and heartache are we going to help guide families through. And part of that, pins and needles too, is this feeling of angst right now too.
What's the hardest thing right
now? For me, it's, trying to lead a team, and to lead friends that I love and care for, and colleagues through this uncertainty, that we're trying to show up for each other, so that we can show up for our communities. but navigating that fear and uncertainty while also worrying about our own kids and our own health is the hardest part. And having hoped that this would, we would have been in a different place in August of 2021, and now looking forward and not knowing when we'll, when we'll have moved past this is, it's challenging to navigate that uncertainty.
The tears that you posted, was that about something direct and specific, or was it a general response? What were those tears for?
It was an exhalation. I think it was just a cumulative sigh. I had been talking to several friends who had been feeling this just building pressure and weight, and one of them said, I see you, and I think just being validated in what I had been feeling just really hit me, and that it hit me sort of what we've been through, what we're continue to go through, what our communities, our family, our loved ones do. It was just that moment of just, I think, feeling seen, that it was okay to feel heartbroken right now, to feel sad, to feel angry. And that all of those are normal parts of grief and processing. And I think it was just that. And you know what? Sometimes we just need to cry, and that's okay.
Is there anything the community can do to help the situation?
Yeah, I continue to encourage everyone, and I was in clinic today talking to family members of patients to go out and get vaccinated, to continue to mask up, and those are critically important things for us to hopefully move past this and prevent another wave of another variant. That if we really sort of double down, and every shot counts, every person out there who's considering being vaccinated, that to do it, and so we continue to encourage people to do that.
What did you think when you saw that Ellen Pompeo retweeted your tweet? How did she find that?
So I don't know the answer how she found that. She has been a big supporter of medical communities, from her platform, and for some time. And so I've seen that she's, taken a vested interest in other, individuals and their stories, which is a beautiful thing. And so I appreciate her for that. Ironically, I didn't see it. I was busy running around seeing patients all day yesterday in the hospital. And so I tweeted it early on in the day and then left it, and left my phone to see patients. And a friend of mine later texted me and said, "Hey, did you see that Ellen Pompeo retweeted?" And I hadn't at the time. So yeah, it was a friend who messaged me, and then since then it's had a fair amount of attention. But really, I hope that attention is poured into just humanizing this, that there's just continues to be so much divisiveness, and a lot of ugly name calling, and some directed at me for sharing this side of myself. But I hope it draws attention to that, like, we really are all in this together. And I see the beauty of the best of humanity and compassion here, and I see it every day. And I wish that more people could see that. And so I just wanted to share a little bit of that with the world.